To understand varicose veins, then we should talk about a little bit about veins. So what are veins? Veins are the roads or the tubes that then transfer blood back to the heart. And when they do that, I like to think of it as elevators. And there's a variety of elevators in the veins, and they're contained in the superficial portion of the leg. And so, as you imagine, elevator goes up 4 at a time. Unfortunately, those floors will, if they give out, the elevator, what happens, the elevator drops to the next floor. Similarly, when you lose the ability for those valves, we'll call the valves within the vein elevators, when the valves give way, the blood then drops to the next floor. Unfortunately, that results in pooling or swelling in the leg. And so when these incompetent veins occur, they then bulge with blood and then result in varicose veins. The varicose veins is merely the backing up of blood from those bad veins, those faulty veins. So the larger bulges or those varicose veins in the smaller areas in the leg, which often people will notice are those spider veins. We call them spider veins. And so both of which can be treated. We usually deal with swelling, but they can result in venous ulcers and wounds. And once that happens, that's due to the edema and swelling of the leg, then certainly an intervention will be warranted. And so not necessarily life-threatening, but it can be because if those varicose veins bleed, then certainly it will cause an issue. Unfortunately, females are at higher risk in addition to obesity, pregnancy, and also professions that sit for a long time or then stand as well. First, in the workup, we'll get a ultrasound to then determine if the elevators are dropping from floor to floor. That's called a reflux study. Once we've confirmed that, we then can prescribe compression stockings. So even every day, if you notice that you're having some issues, some swelling, often compression stockings, you can get them from over the counter and they'll do wonders. And so we'll often begin with compression therapy. If there's still persistence of issues, then we can cross the bridge over to a potential intervention. I think that vascular disease is more prevalent and is becoming more prevalent certainly as we have an aging population, whether it be due to, just like the heart, high blood pressure, high cholesterol, but smoking and diabetes are our biggest culprits in vascular disease. The heart receives blood all the time. Unfortunately, our legs are the last to receive blood. First, the heart goes to the arms, the brain, and the belly, but then our legs. And unfortunately, we don't recognize how active we are with our legs. We are, a two-legged creatures, unfortunately, and we recognize that quickly when we don't have the ability to use them. And I think that when we have problems with our feet, wounds with our legs, I think even before that, a vascular workup is certainly warranted, especially with our longtime smokers and our diabetics.